morning, and thank you all for joining us today. I'm Dr. Wilcox, the Community Coordinator at the New Jersey Healthcare Quality Institute. The Quality Institute is a nonprofit, multi-stakeholder advocate for the safety, quality, and affordability of healthcare for everyone. The Quality Institute oversees a statewide community health initiative called Conversation of Your Life, also known as COIL, which is a program of our Mayor's Wellness Campaign. COIL aims to engage communities and residents in crucial advanced care planning conversations. We discuss topics like how to communicate your wishes to your loved ones and healthcare providers, hospice and palliative care, and the various advanced directive documents. Our programming is being adapted to various cultures and languages. Now, we don't know when a medical emergency or public health crisis is going to occur, and the COVID-19 pandemic has prompted many people to consider the advanced care directives they may have been putting off. And we want to make sure that you have all of the information and resources you need to help you make decisions about the type of care that you want. We're going to continue to provide resources and have these crucial conversations remotely through digital resources, podcasts, and webinars like this one today. Now, in 2020, the New Jersey Treasury's Division of Pensions and Benefits and the Quality Institute developed the COIL Workplace Wellness Program to provide crucial end-of-life education to state health benefit plan members and their families. As a benefit to you and your families, we're bringing COIL resources and conversation to New Jersey workplaces, as these conversations are important to have at any age and as early as possible. Now, through the COIL Workplace Wellness Program, you and your family members will receive vital information on the advanced care planning options that are available to you and education on the different types of advanced directive documents. In addition to receiving these resources, we've implemented virtual wellness workshops tailored towards helping you ease the burden of these often difficult conversations. And planning truly has many aspects, from retirement options to financial planning to living wills and the type of care that you wish to receive. And we're here to make sure that you're well equipped and prepared. Please know that this webinar is being recorded and a copy will be posted to our website, www.njhcqi.org, later today. All phone lines will be muted for the duration of the program to limit background noise. And you may ask questions throughout and at the end of the presentation by typing into the chat box or the Q&A box. The topic for today's presentation is wellness and the conversation of your life. And please be advised that it is not the intent of this program or its speakers to provide clinical or legal advice. So today, we're honored to have Tacy Silverberg-Urian, founder of Advanced Choices, Amanda Lewis Arts, Executive Director for Clinical Health Services at CVS, and Heather Boley, Clinical Program Consultant for Group Medicare at CVS, joining us for today's presentation. So after Tacy's presentation, we'll have Amanda and Heather go, and then we'll open up for the audience Q&A session. So without further ado, I'd like to hand things over to Tacy.
Good morning, everyone. I am looking for my screen to share. All right. Are you guys able to see my screen?
Now, could you try it one more time?
Are you able to see it now?
Yep, perfect.
Oh, wonderful. Thank you and welcome this morning. And thank you, DAPA, for having me here. Hello and welcome. My name's Tacy Silverberg-Urian. I'm a certified hospice and palliative care nurse, and I'm also the president of the New Jersey Hospice and Palliative Care Association. I've been a registered nurse for over 40 years, and I founded Advanced Choices to help families and communities learn about the importance of advanced care planning. I also serve as the chair of Essex County's Conversation of Your Life program, also known as COIA. In my previous role, I conducted family meetings and cared for patients that were seriously ill. I witnessed many families struggle with end-of-life decisions, so I made it my personal mission to educate the community to prepare. Don't wait too long to identify what's important, and instead be proactive and begin this dialogue now. We have control over ours and our families' end-of-life options. Sharing your values and beliefs is an important step in case you're not able to speak. You want your friend or family member to know what's important to you. I'd like to share a personal story. A few months ago, my family struggled. An aunt was hospitalized for depression, and during her hospitalization, she was infected with COVID. Nobody in her immediate family expected that she would decline to the point where she was unable to communicate, get out of bed, or eat. Her husband, my uncle, was her healthcare proxy, but he left his son in charge of the decisions, and he's a physician. Her other son didn't agree with what steps to take, and this caused a lot of tension, anxiety, and anger. There was no previous discussions about what is important to her at the end, and there was no advance directive. This is an everyday scenario. So I'm glad that you're attending this webinar today to learn how you can avoid these struggles by learning why advanced care planning is important. The goal of my presentation today is for you to understand the value of advanced care planning and to name 2 tools or resources to use to begin important conversations with those that matter most and document them. I will also share strategies on how to communicate your care conversations with loved ones and your healthcare providers. And I will review my 2 favorite tools so that you can have these conversations with those who matter most to you. Why is advanced care planning important? We all need to plan for a good outcome. I challenge you to think for a minute about the type of planning that would go into an amazing vacation. What would happen if you did not plan? Would you only look at one option or follow what your neighbor suggested? How would you get there? Who would you go with? Where would you go? We all need to be comfortable with the same kind of thoughtfulness for our final journey. Let's face it, life has a beginning and it has an end, and the end is not optional. It will be our final life cycle, so we might as well share our hopes, goals, values, beliefs, and preferences so that the people who matter most are not left guessing what you want. Now, I understand this is a really heavy topic, so at the end of my presentation, I'm going to share a 2.5 music video entitled Mortality 101 to hopefully get you thinking and hopefully dancing. So I'd like to take a poll, and you'll see it in a minute there. If you check your bar down at the bottom, have you completed your advance directive? If you can please answer yes or no, that would be great. And then we'll talk about what we find. So what is advanced care planning? Advanced care planning means multiple things for different people. For this webinar, we're speaking specifically about the medical advanced care planning. Other topics can include your last will and testament, retirement and financial planning, creating trust and estate planning. Those are different topics. Typically, when we refer to advanced care planning, we're referring to the process of planning for future healthcare and personal care. It's a method to guide decision-making at a time when you can no longer make or communicate your own decisions due to your lack of capacity or ability. For the past several years, in my role as an RN hospice clinical liaison, I conducted family meetings in the hospital to discuss goals of care and to explain the options of hospice and palliative care. Seeing and experiencing how my patients and family struggled in the ICU or hospital without an advance directive was difficult. Most were suffering from end-stage disease, like heart, kidney, lung, dementia, or cancer. Others were elderly and medically frail, and they were being kept alive by artificial means. These families were distraught because they could see that their loved one was suffering. And oftentimes, physicians could be vague about their conditions or prognosis. All too often, there wasn't an advance directive or a proactive discussion about what to do in these situations. These families were being asked to make very difficult decisions. Should they make their loved one a do not resuscitate or disconnect from life support? Could they elect comfort care with the support of hospice? Making decisions during time of a medical crisis is wrought with feelings of anxiety, guilt, sadness, and uncertainty. Emotions are extremely high. We need to have these conversations long before we end up in the hospital in a medical crisis. We need to prepare. I can attest to how many families struggle, and I can say that the families who prepared and had these important discussions felt more at ease because they knew how to respond to the healthcare team. They knew what their loved one wanted. They knew what was important. You're not alone when it comes to talking about death, dying, or end-of-life wishes. Very few people have done so. Not surprisingly, this past year of COVID, there has been an increase in interest. Did you know that according to the Conversation Project, 92% of people say that talking with their loved ones about end-of-life care is important, but only 32% have done so. Other surprising statistics include that 21% of people say they haven't had the conversation because they don't want to upset their loved ones. 53% say they'd be relieved if the loved one started the conversation, and 95% say they are willing or want to talk about their end-of-life wishes. But then you ask, why this gap? Based on questions from community, there is a need for education. I think I advanced it too much. Here we go. Prior to the COVID restrictions, I provided presentations like this one in the community at libraries, senior centers, and community forums. And I asked the attendees, what are your obstacles to having these difficult conversations? And these were their top questions. How do I prepare for these conversations? Whenever I've tried to talk to my adult children, they don't want to talk about it. What's the best way to approach this delicate topic? What are some good conversation starters? There are so many different forms. I'm confused. Where can I obtain an advance directive form? What's the difference between an advance directive and a living will? We're going to answer several of these questions today, but understand that there's no guide, there's no single conversation that will cover all the decisions that you and your family may like or may face. It takes time and persistence to have these conversations. So now I'd like to take another poll. I'd like to find out, what are your barriers to completing your advance directive? Is it, if you can just check off the box, one, I don't know how to start it because I don't know I had options, or I don't know enough about the subject to even begin. It's difficult to face my own mortality. Is there another reason? Or you've already completed your advance directive. We'll probably find a lot of commonalities with others here. Well, it certainly is not easy talking about death or dying. I've noticed that at get-togethers, conversations often veer off to the topic of dying. And this is the time I notice the room emptying. Then people avoid eye contact with me. Either they look away, run away, or they look down at the floor. Have you ever noticed that? I've heard that one of the best ways to clear a room is to tell them you're a hospice nurse. And I can attest to that. Let's face it, we live in a death-denying society. and most of us have not developed a language to speak about it. What about developing a death literacy, a common language to speak about how we do or don't want to die? Today, I hope I can help you identify a strategy to begin thinking and talking about your end-of-life wishes or your advance directive with your family and your provider. We already identified the top reasons people are not talking about dying. All of them are legitimate reasons. The good news is that you're not alone, and therefore, I am going to share two tools, your conversation starter kit and the 5 wishes to help you with ideas. I will provide you with their websites so that you may access these tools. Many past participants found these tools helpful. Then I will briefly review New Jersey's advance directives. The Conversation Project is an initiative of Cambia Health Foundation and the Institute for Healthcare Improvement. It's a not-for-profit organization. They provide various starter kits like these. There are booklets for caregivers of people with Alzheimer's or other forms of dementia, caregiver of a child with serious illness, and there's a new one called What Matters to Me workbook. And this workbook helps you get your thoughts together so that you can have this conversation with your healthcare provider. And the best thing about these is not only are they user-friendly, they're also free to download. And they're available in English, Chinese, and Spanish. It does not answer every question, but it'll help you get your thoughts together and then begin the conversation. You can use it whether you are getting ready to tell someone else what you want, or if you want to help someone else get ready. It's not intended to be completed in one sitting. Instead, it can be used over the course of many conversations. All families are different when it comes to talking about dying. I was incredibly lucky. My Filipino mother was a very practical and religious person. And when it came to talking about death, she oversaw all their healthcare decisions. Several years ago, at age 90, my dad suffered a stroke and ended up in the hospital. But based on their previous conversations, she knew that he did not want to be in the hospital, and his preference was to die at home. So once the physician confirmed that he met the criteria for hospice, he was discharged on home hospice. Hospice covered the cost of his medications, the hospital bed, incontinence supplies, professional and paraprofessional visits. Our family took turns caring for him at home. And when he died a peaceful death, he was at home, surrounded by the entire family, just as he wished. My mother had strong beliefs and an acceptance that when it was her time to go, it was her time to go. No aggressive artificial treatments to prolong her life. So when she was hospitalized and diagnosed with stage 4 breast cancer with mets to her bone, all of us children knew what to do. Her verbal advance directive to us was, "Bring me home, make sure I'm not in pain, and let me go. I've lived a long, happy life." So both my parents died peacefully on home hospice services. And although her wishes were not written down, she verbally made sure we and her healthcare provider knew exactly how she wanted to die. I'm going to review some of the questions in the Conversation Starter Kit to give you an idea of its user-friendly format. It begins with questions to help you think, what do you need to think about or do before you feel ready to have the conversation? Do you have any concerns that you want to be sure to talk about, like making sure finances for a particular family member is taken care of? They even suggest writing a letter to yourself, a loved one, or a friend. The main thing is that you begin thinking about it. You might even practice having a conversation with a friend. Remember, it's not a one-time thing. It's the first of many over time. My mother began sharing years before my dad was hospitalized. She would just randomly say things like, you know what, when I die, this is where you'll find the information about our burial plot, who to call. Here's my bank book. Here's the life insurance policy. And all of us adult children would say, you're not dying yet. We don't want to hear that. But you know what? She planted a seed. And over the years, all of us adult children were on the same page at their life's end. Continuing on in the booklet, it asks you to finish this question. What matters to me at the end of life is, and here you would define your idea of quality life. For example, for me, quality would mean that I would be able to recognize my children and my family. Or some people would like to be in the hospital with excellent nursing care or dying at home, being able to say goodbye to the loved ones, that I'm not suffering. And then the next 2 pages include statements to complete based on a scale from low to highly agree on how you feel about it. For example, as I receive care, I would like my healthcare team to do what they think is best, and you would rate that not so much. Or I would like to have a say in every healthcare decision, and you would rate that very high if that's what you wanted. Another example is, if I had a terminal illness, I would prefer to not know how quickly it's progressing as a low, to high, to know my doctor's first estimation for how long I have to live. And then once you complete these pages, the questionnaire asks, what do you want? Who do you want to talk to? When would be a good time to talk? Where would you feel comfortable talking? This is just a summary of what you will find in the starter kit. Once you're given yourself time to think about how you feel, you will be more comfortable having this conversation. So I'd like to share what that book looks like. It looks like this. It's very user-friendly. And there's fill in the blanks. And like I said, there's scales in there. So it's very user-friendly. So now I'd like to move on to the 5 wishes. It's one of the most popular advance directives because it not only addresses choosing a healthcare proxy and medical treatment, but it also addresses the psychosocial, emotional, and physical caring aspects of how you want to be cared for at the end. But first, let's acknowledge that it's difficult to start this conversation. There's many suggestions on how to break the ice, or you can take on my mother's approach. It was persistent and annoying. Remember, be patient. A couple of my friends have reported their adult children running away from them when they've wanted to talk. Some people may need a little bit more time to think. Every attempt at the conversation is valuable. It may take several attempts. Nothing is ever set in stone. You and your loved ones can always change your minds as circumstances change. But here are some of the suggestions for icebreakers. And I have heard back that it's best to make an appointment with whoever you want. You can say things like, can we meet for lunch? I just completed this form about my end of life wishes and I want to share it with you. Or you can say, remember how Aunt Esther died? Would you consider that a good death or a hard death? I want to talk about it and what's important to me. But once you have that strategy on how to approach the conversation, you will want to complete an advance directive. I'm going to review my favorite one called the 5 wishes. Medical advance directives and living will are used interchangeably, and they mean the same thing. There are various medical advance directive documents like this one, and others may include medical procedure choices. Many people think that you need a lawyer to complete an advance directive, but you don't. If you have two unrelated people sign the document who witness your signature, it becomes a legal document here in New Jersey. And I just happen to have a copy of the 5 wishes here. This is what the booklet looks like. It's a few pages and it's the same. I like this document the best because it has all these options and all you have to do is cross off the ones that you're not interested in. So I'm going to go through those 5 components. Wish number 1 is choosing a healthcare agent. Your healthcare agent, substitute decision maker, they're all referred to as a healthcare proxy. This will be the person who speaks on your behalf if there comes a time when you're not able to speak for yourself. It could be your partner, an adult child, an adult friend. The main thing to remember, it doesn't need to be a family member, but it needs to be someone who you believe can honor your wishes. My sister-in-law died at age 50 of colon cancer, and she did not choose my brother as her healthcare proxy. Instead, she chose her sister, who would carry out her wishes. Wish number 2 also asks you to think about the kind and how much or how little medical treatment you will or don't want. It asks about the type of life-sustaining interventions to start, continue, or discontinue, which includes artificial nutrition, a ventilator, CPR, based on your condition. Now, these are all very personal choices based on your beliefs and values. I have observed patients with Alzheimer's who are bedbound, incontinent, and with pressure ulcers, hospitalized multiple times over the course of several months. They come into the hospital, they're treated with IV antibiotics, and then sent back to the skilled nursing home. And it's like a vicious cycle. But because there was no advance directive and no previous discussions about what the patient wanted, the daughters and sons agonized over what they should do. Should we sign the order for do not hospitalize or no further aggressive treatment, including IV antibiotics? These are incredibly sad and complex situations, but they happen quite regularly. In wish number 2, you also have the option to write in that you want hospice care if you're diagnosed with a terminal illness and your physician certifies that he or she would be surprised if your prognosis was 6 months or less. Hospice care is covered under the hospice Medicare benefit, and most insurance companies also offer this benefit. Hospice services are provided mostly in the home setting by a hospice agency, which consists of an interdisciplinary team. The hospice benefit covers the services of the team, medication related to the hospice diagnosis, like pain medication and other palliative type medications, durable medical equipment, such as a hospital bed, oxygen, a bedside commode, and medical supplies. Hospice services are provided to assist the family care for their loved one in the home. It doesn't cover 24-hour continuous service, but it does provide 24-hour on-call coverage for support and emergencies. Hospice can also be provided in long-term care settings and in rare circumstances in the hospital. Wish number 3 is about comfort. It includes things like how you want your pain, depression, or nausea addressed, and if you want your favorite music played, or if you want to be massaged with warm oils. And like I said, what makes the 5 wishes document easy to use is that it lists multiple interventions, and all you must do is cross out anything that you do not agree with. Wish number 4 is how you want people to treat you. For example, do you always want people present with you? Your hand held? Do you want prayer? Do you want to die at home? And wish number 5 is what you want your loved ones to know. For example, I want them to know I love them. I want them to respect my end of life wishes, even though they may not agree with them. This wish includes your funeral, or memorial wishes. Next, you will need 2 witnesses to sign the document attesting that you signed the 5 wishes. And then you're going to want to make several copies, one for you, one for your healthcare agent, family members, and your primary care provider. Then you want to make an appointment with your healthcare provider to review it, and as many family members as you'd like to share this document with. You'll want to keep this advance directive in an accessible place. Don't put it in your safe deposit box. Make sure your friend or family know where to locate it in your home. If hospitalized, bring it with you, or ask your healthcare proxy to bring a copy for your medical chart. If you're interested in completing your 5 wishes, later on in this presentation, just check the COIL website or YouTube for my webinar entitled 5 Wishes Made Easy, and I'll walk you through each one of the steps. New Jersey has 2 types of advance directives. These forms are easily accessed on newjersey.gov website listed here, and it's easy to complete. The first one is the proxy directive or durable power of attorney for healthcare. It asks you to name a person as your healthcare representative. You'll also need to name 2 other alternatives just in case your first pick is unavailable, unwilling, or unable. And then you're going to have to decide how much decision-making power to give to your healthcare proxy. The second document is the New Jersey Instruction Directive. There are 4 parts to this document broken down into general instructions, which addresses your personal views regarding healthcare. There's also sections on brain death and anatomical gifts. So after completing these sections, as with the 5 wishes form, it requires that you name 2 individuals to receive a copy of the document. Then you must sign along with 2 people who witness your signature and state that you are at least 18 years old, of sound mind, free of duress or undue influence. So in summary, I hope I've given you enough material to begin thinking about what you need to do to start thinking about what's important to you and how to complete these advanced care planning. By having these vital conversations with a friend or family member, you'll continue to realize what's important to you. The critical thing to remember is that it's never too early to begin this conversation. Please do yourself and your family a big favor. Start talking about what's important to you at the end and document these wishes. I always like to say that completing one's advance directive is a gift to your friends and families to guide them to do what is right for you. But before I share that wonderful music video, I'd like to get your feedback to this question. It's the last poll question. How many of you, after learning about these tools, feel a little bit more comfortable in discussing your wishes and completing your advance directive? If you can just answer yes or no. And then I'm going to share this. I'm hoping I know how to do this, sharing this video. All right. I hope you enjoyed as much as I did. And I wanted to just say that I did get permission from Bevival.com and the founder, Karen Martineau, to share this with you. And after the music video, I will share the links to my favorite tools, and I'll turn it over to Amanda Lewis and Heather Boley, who will discuss Aetna's Compassionate Care Program. And then we'll open it up to questions. Again, I thank you for participating and in allowing me to present this information to you. Here we go.
Hey there, MCSS here. I got Breezy Ballad with me here today, delivering an important end-of-life message. So listen up. This is Mortality Awareness 101. You may want to take notes. Hey, this is going to be fun. We'll get into the hard stuff, the nitty gritty. Maybe a little rough, not always pretty, but we all got to deal with it sooner or later. So don't wait until it's too late, alligator. Time to take care of business. Plan ahead. You won't be able to talk about this when you're dead. Give your loved ones the best gift of all. Make it easy for them. Hey, it's your call. Spell it out. Get your papers in order. Give away your junk. Don't be a hoarder. Finish your projects. Pay off your debts. Now's not the time to be hedging your bets. Gotta get this topic on the table. Let's do this, yeah, while we're still able. Let's talk about death, baby. Let's talk about family. Let's talk about who decides what and who might disagree. Let's talk about what matters most to you. What about organ donation? There's so much to think about and do. Let's have that conversation.
Some ways for no man. So you better not get stuck without a game plan. Get your affairs in order, start saving. Cause when it comes to death, there's no safe haven. Tomorrow's not a guarantee. So you gotta do what's best for your family. Stay strong if you move on and ensure that they can live life comfortably. Mortality, because death is just as real as reality. Mortality, it don't discriminate whether it's you or me. Mortality, because death is just as real as reality. Mortality, it don't discriminate whether it's you or me.
There's people out there who can help with the convo, all about the options, how it can go, the who, what, and when, your final agenda. No need to wait till the bitter end. You fight to be independent and strong, but medical interventions could get it wrong. So if you want your wishes protected, better be prepared for the unexpected. Fill out the forms, you'll be all set. Better do it now before you forget. Healthcare proxy, power of attorney, map it all out before you start the journey. Put in every detail you can think of. These decisions are an act of love. Think about the future, how the story will end. Death literacy, it's the latest trend. Let's talk about death, baby. Let's talk about family. Let's talk about who decides what. No reason to disagree.
Okay, so I hope you enjoyed that music video, and I hope you understand the importance of advanced care planning. On this resource page, I've included my two favorite tools. If you want to complete your 5 wishes document, I posted my video, 5 Wishes Made Easy, here, or you can access it through the COIL website. I thank you again for attending and look forward to your questions. Now I'd like to turn it over to Heather and Amanda. Thank you very much.
Hi, my name is Amanda Lewis Arts. Thank you so much for having us today. We are excited to be able to talk to you about our Aetna Compassionate Care Program. Truly, the goal here with our Aetna Compassionate Care Program is to provide support and encouragement to everyone who is facing a very serious illness or end of life. You know, Tazy said some wonderful things that absolutely rang true with me as I listened to her presentation. You know, she had mentioned that 21% of individuals don't want to speak about this topic because they're afraid to upset their loved ones. And we do hear that as we work with retirees in our care management program here at Aetna CVS Health. And what we find is that they want to have conversations. They, you know, our retirees are at this point, they want to have those conversations and they want assistance in facilitating discussions or talking through how they can approach the topic. And so in our compassionate care program, that is something that we do focus on, and we do leverage conversations of your life and the 5 Wishes program to help with those conversations. Just a little bit of background on this program. It began many years ago, and in response, we had a palliative care physician by the name of Dr. Randy Krakauer, who felt very passionately about compassionate care and felt there was a need in our industry to develop a care management nursing program to support retirees who were going through this phase of life. And we rallied together and we built this very strong clinical offering with multidisciplinary support for the Aetna retirees who are facing end of life, in hopes of improving quality of the care that they're receiving, improving quality of life by addressing symptom management and pain management issues, but most importantly, being there to support them emotionally and being able to support caregivers emotionally and walk through what is important to them as they near end of life, and being able to really hold their hand and bring in spiritual supports and encourage closing of issues or problems that they've had in their life. So we're very excited to talk to you about this program today. If you are an SHBP or SEHBP Aetna Medicare Advantage member, you are eligible for this program. We do have clinical program support that's available to you. And I'm going to now hand it over to Heather Boley to give you some more details about our program. Thank you.
Thank you, Amanda. Can you hear me okay?
Yes, we can hear you.
Oh, thank you. Good morning. My name is Heather Boley. I'm a clinical program consultant for Group Medicare, and I'm going to give you a little more detail regarding this program. Through the Compassionate Care Program, our nurse case managers can help you make choices that are best for you and your family. Our nurses understand the physical, emotional, and cultural needs of our members and families dealing with advanced illness. They provide support and education and can connect you with community resources. They understand treatment options and can provide tips on how to manage pain and symptoms. They can help develop care plans with your doctors and specialists. Our nurses can also discuss advanced care planning to ensure you have the right resources and final wishes in place. The nurse case managers are your main contact, but you also have access to our pharmacists, social workers, and behavioral health specialists as well if needed. The services and resources available through this program are at no extra cost to you, as mentioned earlier. And if you would like additional information, contact your member services team. And if we go to the next slide, there are some contact numbers for you. Monday through Friday, 8 a.m. to 6 p.m. Eastern Standard Time. And I want to thank you for attending today.
Okay, so thank you, Tacey, Amanda, and Heather for all of that helpful information. And before I open it up for audience questions, I just wanted to give a quick reminder that this webinar will be available on the COIL webpage so that you can review the information that you may have missed and you can share it with your family members and your friends. And we have plenty of other resources available for you as well. And we have webinar recordings with various topics that may be of interest, including but not limited to support for caregivers, advanced care planning for patients with dementia and Alzheimer's, having the conversation with veterans, and many more that we didn't get to dig into the details of today. So we encourage you to visit our website and take a look at these resources. It'll help you and your loved ones start thinking about your wishes and strategies for how you can comfortably approach these conversations with one another and your healthcare providers. So now I'd like to go to the Q&A session. Oh, someone would like me to pull up the Aetna numbers again, of course. One moment. Now, we do have a question here that says, will New Jersey directives be recognized in other states?
I can answer that, Dapa. Yes, they are intrastate. Medical advance directives are intrastate documents.
Perfect. Thank you. And I know you had covered a couple of advanced directives earlier. One that we didn't mention was the POST form. I know people ask questions about that quite often. Would you be able to give us a little bit of insight on what the POST form covers?
The POST, P-O-L-S-T, is an acronym for Provider Order for Life-Sustaining Treatment. And that's a document that oftentimes a healthcare professional, like an advanced nurse practitioner or physician, has with someone who is seriously ill. And they have a conversation about what medical interventions they would want if they were hospitalized. This is a medical order, so they bring it with them to the hospital, where the staff at the hospital or facility will have to respect and follow as if it is a physician's order. And on it, it will list do not resuscitate or do not intubate, no IV antibiotics, no ventilator. It's very specific about what they want and what the goals of care they would like if they were hospitalized. And oftentimes these forms are not just completed on healthy people, it's really more the seriously ill people that come to the hospital with these forms.
Thank you for that. And we have one for our Aetna team. How will the compassionate care manager coordinate with your long care coverage?
Yeah, so we absolutely do coordinate with long-term coverage. We work with the member themselves, and if the member gives us permission, the member's family too. Members' families often really need a lot of extra support. This, as you can imagine, is a very challenging time. And so it is our job to coordinate not only with the member and their other care providers, but also the family.
Thank you. And we have another question for you, Tacey. So this is one that we get quite frequently, actually. So what is the difference between palliative care and hospice care, and what do each provide?
If you could imagine like an umbrella, that is the new specialty of palliative care. It's like an umbrella. And under that umbrella is subgroups or sub-programs, and hospice services is one of them. Palliative care is a specialty to help people with serious illness with their symptoms, helping them with having the conversation, understanding what goals of care are. It happens long before a patient is placed on hospice. But in hospice, I'm a certified hospice and palliative care nurse. We have to learn all the palliative types of medications to be able to aggressively treat the symptoms that the patient is having when they're on service with hospice. But let me just give you an example. Someone with like heart failure who requires medication, IV medication, to keep their blood pressure up or keep their heart pumping, and they're not quite ready to stop those things, and they don't really want hospice. So palliative care gets involved, and oftentimes they make the contact while they're in the hospital setting. They ask for a palliative care consult, and that specialty looks at the patient more holistically. When you're in the hospital, if you're in there for let's say kidney failure, you just have specialists coming in. It's very siloed, the care. So the renal doctor saying one thing, your cardiac doctor saying another thing, and palliative care will come in and take a look at all of the systems and then provide explanations, answer questions, meet with the family. So, because oftentimes the family has questions, come up with a plan. But really it's identifying what the needs are for that patient, because it could mean that they'd like to go home, but can they go home on these specialized IV medications? And there are many different ways to get a patient home. You can discharge them on home care and not hospice, and you'd get an infusion company to come out and provide that medication. So palliative care is really more holistic, and it happens over a longer course of time, versus hospice is really provided really toward the end of life. And two doctors have to certify that this person has a terminal illness. And in their best estimation, they would be surprised if this person was still alive in 6 months. And, but what often happens, sadly, is that hospice gets the referral so late, where the patient like almost, in the 11th hour, and it's really a shame, because the hospice interdisciplinary team are so skilled and so compassionate that I know for my family, they were very supportive. We had them, for a couple of months, and they got to develop a relationship with my mother and with all of us. So that's really the main difference between hospice and palliative. I hope I answered the question.
You did. Thank you. And we do have a couple of questions for advanced directives. The first is, what is the difference between a living will and an advanced directive?
They're the same. They use those names interchangeably. And then I just wanted to mention that the New Jersey directives are free. You can just go onto that website that I provided for you. And Dop, are you going to put the presentation on your website as well, so they have access to the resources? Okay.
There will be, the slide deck will be available, as well as the recording, and 24 hours after today's presentation, everyone who registered or attended, sorry, let me clarify, will receive a follow-up email with all of the resources and links that were addressed during today's webinar.
Perfect. So the New Jersey advanced directives are free. You can download them. The Conversation Project resources are free. There is a cost to the 5 wishes. But oftentimes I have found that, and I don't know if this particular company is going to provide the 5 wishes. During COVID and at the rise of COVID, that company, Aging with Dignity, provided free 5 wishes. I doubt they're still doing that. So there is a cost, and I believe it's $5 per document. But if you buy bundles, you can get big discounts. So I just wanted to mention that.
Thank you for clarifying that. And the other question around advanced directives is, once you complete one, can you modify the contents at any time?
Yes, you can. And what you're going to want to do is in documenting, you're going to put a line through whatever has changed and initial it with the date, and then write revised. Or you can start all over again and get 2 different people to sign with you. And just, if it's changed so much that it would be very confusing for anyone to follow, then I would recommend that you just get rid of it and start all over.
Thank you. And we have another question that just came in. Is there a limit for hospice care? And what about people with dementia who have extended illnesses and needs?
So with the hospice Medicare benefit, like I mentioned, it's looking at a prognosis of 6 months or less. And I know for a fact that there are patients with Alzheimer's that, continue to live, past the 6 months or shorter. When a hospice comes out to evaluate a person, they're using many different scales to try to, what they call, prognosticate the disease trajectory. So based on a person with Alzheimer's, they use a scale called the FAST scale, and they look at the functional level. Is that person able to string 3 words together? Are they incontinent? Are they still able to sit up when we put them in the chair? Or are they able to walk? So based on these tools, functional tools, is how a hospice will decide if that patient is eligible for hospice. And once they are on the hospice program, the initial period they certify them for is 3 months. And then, they're always evaluating for progress or decline. And Medicare will continue, and insurance companies will continue to reimburse for services and have them eligible for hospice as long as they continue to meet the criteria. So the criteria is very detailed. They look at BMI, they look at weight loss, they look at, functional capabilities, and the hospice has to be able to defend to the payer that this person in fact continues to meet the Medicare criteria. I've seen patients on service for over a year, and I've seen people on for just 3 days, so it's different for everyone, but I hope I was able to answer that question.
That was perfect. Thank you. And I know we only have a couple of minutes left, but I did just want to share the poll results from the question about the barriers to completing your own advance directive. I just wanted to ask you, Tacey, from your experience, what are the biggest barriers and concerns that patients and families have? So let me just pull that up for you. Let me know if you can see that.
Well, it looks like there's like half of you guys have already completed your advance directive. So that's wonderful. Congratulations. There's other reasons, and I don't know enough about the subject to begin. And I think that that's pretty valid. There's so much, because we live in a death-denying society, people really don't want to talk about it. And we've often just left it up to our healthcare system to decide for us. And we kind of defer to the physician as if they're a god. But really, as a nurse, I've seen so many things at the bedside that I, suffered from moral distress because, I could see that the person is suffering, but, the healthcare providers are not being clear with the families in terms of what their prognosis is. And, I hate to say it, but let's face it, we get reimbursed from Medicare based on how long a person is kept alive, So now with science, with medical technology, we've advanced to the point where we can, prolong people's lives. And we're not so sure that this is, the best way to handle our mortality. When you look back at the turn of the century, a natural death was dying at home surrounded by family. But because of the medical technology, we've been able to prolong life, even with chronic illnesses. I know for a fact, I'm in my 60s and I'm on high blood pressure medication and on statins for my cholesterol. Years ago, we didn't have that. And so people died at an earlier age, but now, which is a good thing that we're able to manage certain chronic illnesses. But when it comes to the time where your body begins to fail and you end up in the hospital without an advanced care plan, without a directive, or talking to your family about what you want and what you don't want, sadly, what I see is that people will defer to the healthcare providers, which is why it's so important for everyone to begin talking about what's important to you, not even about the medical interventions, but just to say to your family, you know what, if I'm not able to recognize you guys and I'm not able to, feed myself or watch football or whatever quality is to you, then, really question whether or not, if I can't talk anymore and tell you what I want or don't want, please don't do anything extraordinary. And, my preference is really to die a peaceful death in my home, surrounded by my loved ones. And I want to make sure I'm not suffering, and if you're able to say that to your family, like my mother, who was so annoying, but we were all on the same page when it came her time, that often is the best way, is just identify how would you like to live? And oftentimes when families were sitting in the ICU looking at their loved ones with the ventilator, and they're non-responsive, and they would be so confused. They don't want to kill them by, discontinuing the ventilator. But I said to them, imagine your mom sitting up right now and she looks at you in the eye. What would she say? Would she say, continue with this care? Or would she say, I've had enough. I've had a great life. Let me go. And so you don't want your family to struggle with that question at the end. You want them to feel empowered, that they know exactly what you want. They want to honor your wishes. So, that's, my passion and my hope for everyone that's attending today. And, just if you have any questions, I'm going to allow DAPA to provide my information. If, I have been consultant on many occasions. That's what I do, to help them through, difficult conversations.
Yes, no, thank you, Tacey, for all of that. And thank you, Amanda and Heather. Today's presentation was wonderful. In light of time, we are a little bit over the hour, so I do want to let everyone go. I just want to say thank you all again for joining us today. I do see we still have a couple of questions coming in, so I'm going to take down your names and I'll definitely put you in touch with Tacey afterwards, or you can email me at the email that's listed here, dwilcox@njhcqi.org, and we'll get all of your questions addressed as soon as possible. So once again, I just want to say thank you all for that wonderful presentation, and I hope you all enjoy the rest of your afternoon. All right,
Thank you.